Good afternoon, Saint Lucia, and thank you for joining us for this update to Saint Lucia on Saint Lucia's COVID-19 response via the national television network and our partner stations. Sorry for the late start. We know we're competing today with quite a few things that are happening in the U.S., but this update is very important and timely in light of some of the things that have been transpiring. Leading the update today in studio is Prime Minister Honorable Alan Shastney, Chairman of the COVID-19 Command Center, Honorable Dominic Fede, Chief Medical Officer Dr. Sharon Belmar-George, Deputy Police Commissioner Mr. Milton Daisy, and our Chief Education Officer Dr. Fiona Meyer. As is customary, we will begin with an update on the situation from our Chief Medical Officer, Dr. Sharon Belmar-George.
Good day. Thank you very much, Ms. McDonald. Good day to everybody in studio. As is customary, we'll give the total number of cases and to give you an update on our epidemiological curve. Can we have the dashboard, please? Thank you. To date, we've noted a total of 713 confirmed cases. We also note 418 recoveries with 287 active cases. We've had 5 repatriations and a total of 8 deaths. We've also done a total of 22,768 tests nationally. To give you an idea of the case distribution of our 713 positive cases that we've noted throughout Saint Lucia, the bars give you an idea of the number of cases and their distribution throughout the various districts, and the incidence rate is the blue line. At this point, the Grosile area has the highest incidence of cases being noted across the island, and this data is from the 11th of March to January 20th. Our epidemiological curve to date, as you're aware, we managed a smaller wave in March with a low transmission rate. Also between October, November into December, we managed a medium-sized wave, and now in January, we're managing the biggest wave that we have seen to date here in Saint Lucia. In terms of our contact tracing that we've done for our last wave, there are a number of things that we saw and we anticipated. Our waves generally are noted after increased activity, and this is similar to what we are seeing during the month of January. With this last wave, you'll notice the numbers are a lot higher than our previous waves. What we've noted during the period of December 21st to January 11th, the increased number of contacts per person due to the attendance of multiple activities, lack of adherence, and lack of physical distancing. And during that point, we were monitoring 163 primary contacts of cases. From January 12th to date, the increases are in nationals, and the cases noted are families of contacts and contacts of positive cases, some cases of transmission through workplaces, and continued social activities. We are presently monitoring 270 persons at this point. This gives an idea of the trajectory through October, November, December, where we got a reduction in cases, and in January, we note the increases coming on. So we are at a very critical point now in January with the increased number of cases that we are seeing, and as I indicated earlier, from the 12th of January, we're seeing the secondary effects of the activities, that is, persons who did not necessarily attend high-risk activities, but the families of those persons and also their contacts, be it at work or other social activities. So that is what we're picking up in our contact tracing. The distribution and the incidence rates of our positive cases indicates that we continue to see the highest number and incidence from the age group 25 to 49. It was important to highlight the age-specific rates for COVID-19, given that schools have been opened. I think it's important that we note that the typical school age accounts for 11% of our infected population. We have the various age groups, that is the preschool, infant, primary, secondary school, to give an idea of the numbers that we are seeing within these. The 25 to 49 remains our highest numbers and the incidence, for the incidence as well, per 10,000, and this relates to what we're also seeing in the contact tracing process relating to increased social activities of that age group. The ministry, the numbers that we also noted during that period of December, January, apart from the tracing that I indicated, we also have been monitoring and regulating our COVID-19 approved accommodation sites to ensure maintenance of the required standards. Some of the numbers that we note in the spike were in relation to some of the, one of the COVID approved accommodation sites, which during the period November 23rd, we had noted 60 positive cases recorded from there, and this has since led to urgent measures being implemented to contain and manage the outbreak, with public health being the main priority for us. I want to indicate that at this point, based on the numbers that we are seeing in our epi curve and our internal analysis and observations, we have to pay attention to the main risks at this time. Our main risk to continued transmission, and we need to look at all of the risks. We need to address all of the risks because all of them contribute to continued community transmission and how we move forward to the rest of January and February. The risk at this point remains the high risk in the international tourism markets, the illegal entry of persons from countries of high risk who come into communities, the non-adherence of citizens to home quarantine, the non-adherence of visitors to hotel protocols, the reduced use and poor use of face masks in public places, the increased mass crowd events that continue to occur across the island, the crowding of our public buses without the use of a mask. At this stage, we continue to note increases in cases in all communities, and it is imperative that we all take the necessary urgent infection prevention and control measures to reduce transmission to ourselves and family. The new recommended measures aim to urgently reduce movement and interactions to break the chain of transmission of COVID-19. The Ministry of Health, we will continue to monitor the global and regional situation to strengthen the protocols to ensure evidence-based measures are used to guide the recommendations and protocols as we continue to live safely in a COVID-19 environment.
Thank you very much, Madam CMO. I also want to mention that the media is joining us in studio and via Zoom. So we have in studio HTS and Choice, and we also have a number of media houses that are joining us via the Zoom platform. As mentioned by the CMO, we are going to be announcing some new measures and protocols, some of which have already been rolled out by the government yesterday. This will be announced by the chairman of the command center. However, first we will have an opening statement from Prime Minister Honorable Alan Chastanet.
Thank you very much, Nicole, and my fellow Saint Lucians. I've always tried to speak very frankly and very clearly to the citizens of this country, and with the greatest amount of respect. My government, and I believe the officials, have never tried to act like we know more than anyone else. We've tried to come up with policies that are unbiased and that are based on some level of evidence. I want to say to you that what we just received from the CMO, in my opinion, is a report card. And like when we go to school, and I'm not suggesting that I'm treating the population of this country as students, but I'm just using it as an example. Like when we get a report card and it's not good news, we must accept that we are accountable and we're in control of our own actions. And as such, we must take responsibility for the results. I want to share with you the philosophy of my cabinet. And that philosophy is that we focus on the things that we can change. That's what we focus on. Don't sit and lament what has happened in the past. What we do is we learn from the past. So where mistakes were made, acknowledge the mistake was made, and try to remedy that in the protocols and the policies that we have in moving forward. I say this to you also to say that the things that we cannot control, we have to have faith. Many of us believe in the good Lord, that He has a plan for us. And then when He has not revealed to us as yet what He has in mind for us, we must prepare ourselves and adapt as soon as we know what those circumstances and new circumstances are going to be. But we are a positive thinking cabinet. We believe that there is tomorrow. We believe that we will see the end of COVID. And so therefore, we've adopted a protocol in our own cabinet. It's called balance. And what's balance and how does it apply to COVID? The definition of balance is to try to stay upright, to create stability, to have a steady footing. And what have we realized is that COVID is a disruptor. And COVID has done everything to throw us off of our balance. And therefore, the protocols that we're putting in place are to try to achieve and maintain stability, allow us to stay upright, and for us to continue to progress. From day one of this COVID, which we inherited, an unknown virus, it was best guesstimates as to how to contain it, what it was, how it was going to affect people. I sat with you, like you, watching it being unveiled out of China, and then seeing the horrific situation that ensued in Italy, followed by New York City. And we stayed glued to the TV and reports as to what it was and how it was working, and listened to Governor Cuomo and Dr. Fauci, and to our own CMO and to CARFA, Dr. St. John, meeting after meeting, and every day learning something new. Here we are. I'm not saying that we know COVID intimately, but we do know COVID better than we did back in April and May and June. So we know that there are some things that can work. We've learned that we cannot eliminate COVID by ourselves. Even if we were to practice the greatest protocols in Saint Lucia, we saw that the misbehavior or somebody coming in illegally, or as we refer to it as the back door, or that the protocols that we have in our hotels, that there is always that opportunity for COVID to spread once COVID exists globally. So we can't control it by ourselves, or cannot eliminate it. But what we can do is we can control it. And the fight from day one, we have recognized and we said, the first thing to do is to bring COVID under control, which then allows other activities to take place. Because we know that counterintuitively, what causes COVID to spread is human interaction. And that when that human interaction is facilitated through social interaction, depending on how much social interaction we have, that is where the spread comes, because it makes it almost impossible from a contact tracing perspective to determine what the source was. Cabinet works with the command center. The command center, made up of the CMO and chaired by the minister and security and several other entities throughout Saint Lucia, deal with this situation on an evidence-based process. Based on the evidence that's there, they make recommendations. It is then passed on to Cabinet and NEMAC. And between NEMAC and Cabinet is to find the balance. And that's what it is. In weightlifting, we say, no pain, no gain. And sadly, that's where we are. There's sometimes we have to go through some significant pains in order to get the gain of coexisting with COVID, of controlling COVID so that it's not spreading. And the threat of COVID is twofold. One, on lives. And we knew from early that we could never prevent COVID from coming to Saint Lucia entirely. And so the goal has always been, initially, to have slowed down COVID coming into our country while we build up the respiratory center, get the PPEs in place, educate the population on the protocols, and put all the mechanisms in to deal with a potential further spread. I'd like to think that we did it textbook. For the longest period of time, we only had 28 cases, and we kept it to a minimum. The second component was really to make sure that when the spread came, that we would not see an impact where what happened in Italy, what's happened in New York, and what is currently happening in California, where the numbers have risen so much that it's overwhelming the capacity of the hospitals, to the extent that persons who need help can't even get into the hospital. This is something that the CMO and my cabinet, what we go to sleep with every night. That is the fear. That we make a mistake, and that mistake causes the spread of COVID to the extent that it puts this pressure on our society. It was sufficient to watch it on TV in Italy and in New York. We don't need to learn that example for ourselves. That's horrible. And I can say to you that that's what drives our decisions. That's what's in our conscience every day when we make decisions. But at the same time, we recognize that there are livelihoods. That the state does not have the resources like other countries that just print money. In our case, we have to borrow because globally the economy contracted and there was a significant shortfall in revenues from the state. But at the same time, the state has an obligation to make sure that members of our society who cannot take care of themselves, that we're in a position to help them. And that's why the income support programs, the social stabilization programs, the feeding programs that we've done, and in many cases still continue, were so important. But when the opportunity arises that we can allow the economy to grow and to recover some of that revenue, not for the state alone, individuals being able to get a salary and to go home and to take care of their own kids. To give some hope in a period which has been consumed with anxiety. Fear. Not knowing. And when you take away persons' salaries, jeopardize their home mortgages, throw up everything that they have worked their whole lives for, it creates anxiety. We've also recognized that we're an island. And being an island, we cannot remain cut off from the rest of the world. And so keeping the ports open, shipping and airports, was critical. Saint Lucians who wanted to return home to help their loved ones, to come home for funerals, to come home for any other forms of celebration, to take care of their own assets on island. Saint Lucians themselves who need to go abroad for medical reasons, or need to continue their business and to be able to travel abroad. That's a vital lifeline that we had to keep open. We understood that keeping hotels open was a direct way of making that happen. And keeping hotels open was also a way of making sure of the 12,000 people that lost their job, that we can get some of them back to work. We did it knowing that there was a risk. There's risk every day you leaving your home. But we have to. We must. We're mindful of our children's education. Why? Because we can't take decisions every day in isolation of the future. The future is coming. And it will be as unforgiving as it was before. Because the whole world is going through this together. So balance and coexisting with COVID has always been on the back of our minds. And I want to say to Saint Lucians today that as the evidence comes to us from the command center, Cabinet sits and makes these very difficult decisions. There is no print, there's no previous track record as to how to make this work. We constantly want to find that balance. And we understand if we don't control the spread of COVID and it's allowed to spread throughout our society, the pain will be intolerable. Because it means income will be lost, livelihoods will be lost, and sadly, lives will also be lost. And so that's why I'm appealing to all of us to accept our own individual responsibility. I've come and I've appealed many times. I've said, when you don't follow the protocols and you're asking police officers, wardens, nurses, and individuals to involve themselves to correct your behavior, you're indirectly exposing them. They have families. They are members of our own society. A police officer having to go in and tell somebody in a bar to wear their mask, that the bars are closed and to go home, and that that's his friend, or that's a relative. That's how small-knit our society is. But we only have ourselves to hold accountable for our actions. And the success of implementing our actions will produce results. And we have seen an increase in cases. I think it's 459 cases currently. And let's remember that multiplier effect. That if you have 100 people infected today and you have an infection rate of 2, next week it's 200. The following week it's 400 and 800. And then we start getting close to those numbers in which we're going to be overwhelmed. The command center has come to us to indicate that we're trending in the wrong direction. It was hoped that with the continual meetings and interventions and the communication that we've been sending to the population about protocols and adhering to our protocols, and that persons who would have seen the numbers coming out of the activities from December, that there would have been a correction. but there hasn't been. We believe that that's probably because people are suffering from what we call COVID fatigue. Just can't take it on anymore. It's been going on too long. This is too difficult. But I'm appealing to all of you. We all have to dig in. We have too much at stake. We owe it to each other, and that's why we must be each other's brother's keeper in this instance. We all have a responsibility to each other. So, Cabinet has listened, and Cabinet is fully supporting the recommendations that the Minister is going to reveal. And I want to thank the participants in the NEMAC meeting yesterday for their input, and for some of the other sectors who I followed up with even last night to make sure that we're being fair. None of our policies are intended to be biased against an individual, biased against a company, or biased against a sector. COVID determines that. Our success in containing COVID impacts that, because it's social interaction. And there are some individuals, some companies, and some sectors that engage in that. And there are some imbalances and some adjustments that may not make sense. And some people would say that there is a bias. As I said, we're dealing with the new normal. And in trying to keep the borders open for access internationally, to generate income for households, to keep activity going, required us to create a tourism bubble. Tourists don't get to enjoy all of the things they normally would have enjoyed in Saint Lucia. And so it's very easy to sit on the sidelines and to pick holes and to say, well, this needs to be consistent across the board. COVID doesn't allow that. The level of activities and the level of risk all changes. And so we've tried our best to look at each individual, each company, each sector individually, look at the overall goals of what we're trying to achieve, not only in protecting people today, but continuing to build for the future. So I want to say to you that it is a difficult task. Some people would say an impossible task. But Saint Lucia, you've done amazing. Where people thought we would have been today, we're much better. But we have a small crisis on our hands that can become much more catastrophic if we don't address it now, address it firmly, and take this report card from the CMO to heart. Our behavior needs to be corrected in order to generate the necessary results to allow this country to continue to perform. Once COVID is allowed to spread indiscriminately, it is going to significantly limit the policy initiatives that the state can implement. So again, I want to thank all of you for your continued participation. We recognize that there is such a thing as COVID fatigue. We recognize that there is a tremendous amount of anxiety. But I have to say to you that your team is stronger today than it's ever been before, that we're applying the lessons of the past and making sure that we learn from them and strengthen our protocols moving forward. And we will ask nothing of anyone that we don't believe that we can burden. We can't carry that burden. So again, thank you. And I want to thank the Minister for his continual efforts, and the Minister of Health. The two ministers represent the command center very effectively at Cabinet.
Thank you very much, Honorable Prime Minister, for really putting things in perspective in terms of the methodology of everything that's happening and all the organizations and the people behind the decisions that are made. I now hand over to the Chairman of the Command Center, Honorable Dominique Fede, to bring us through all the new protocols, some of which were announced yesterday, but he will run through them again just to announce what is going to be facing this country over the next 10 days. Minister?
Thank you very much, Nicole, and good afternoon to viewers all over St. Lucia, those of you who are joining us as well in the diaspora. We want to say a special good afternoon to you. These recommendations that I'm going to publish today are a stark reminder of the difficulties that countries all over the world are facing as it relates to managing the destruction that is taking place the world over economically, whilst as well trying to ensure that they advance the public health cause in the interest of saving the lives of various citizens. We want to say as well that this has been a juggling act, an act where we are trying to stem an economic tide while as well fighting a health cause, which really has escaped so many countries. I want to also say before I read the protocols that we're seeing around the Caribbean that there has been a wave that has taken place because of Christmas activities in those countries as well. And so if we look at what is happening with some of our neighbors, we also see that they have had to take, in instances, stricter measures that we are about to announce today. So while this is no consolation, we are cognizant of the fact that there is a regional situation that is not immune to St. Lucia. And so after much consultation with the NEMAC group, making up a diverse set of leaders from the private sector, from civil society, from public sector agencies, we came up with 9 main recommendations which were agreed upon in the spirit of cooperation and consultation, all with one goal to, in the short term, reduce the spiraling trend that we see in the increase in cases. And so, number 1, we agreed that the protocol, which we have been publicizing for the last few months, to work from home and reduce contact meetings. All organizations and businesses should continue to implement a blended service operations approach where possible for all operations and employees. Additionally, where possible, there should be a complete move to staff and board meetings being held virtually and online as well. Separate provisions apply for necessary sectors, for example, essential services, construction, manufacturing, call centers, which are buoying the economy at this present time, hardware stores, banks, port facilities, etc. This recommendation shall be in effect as of Friday, 22nd January 2001 for a 10-day period. The second recommendation we came up with was the hours of business operations. And so it was agreed upon that we would scale back from the 11 p.m. Suggestion which existed in the previous dispensation, and we're reverting back to the 9 p.m. closure of all businesses on a daily basis, so as to allow individuals to go to supermarkets, to go to shops, to go to gas stations, and to get those essential household items that we need as we exist in this rather difficult time, so that we don't cause too much disruption in your daily lives. So we're hoping that by doing this, supermarkets and gas stations will be able to get their employees home by 10 p.m. Essential and non-essential activities was also another recommendation. And so there's a long list here of activities that is allowed to open, and these activities or types of companies would include gas stations, supermarkets, financial services, including of insurance, all within a blended approach where we are suggesting to work at home and online where possible, Restaurants, takeout services only, so no dining is being allowed in the restaurant sector. The manufacturing sector will be permitted to operate. Exports as well will continue. Hardware stores, public transportation, vendors on rotation with protocols, and the Castries City Council is no doubt working with many vendors around the city center to ensure that this is facilitated in a very effective and smooth manner. The agricultural sector will be permitted both from the crop and livestock subsectors. Call centers, tourism accommodation services for international tourists. We are not permitting at this time any staycation activity. We want to bring that to a halt. Doctors' offices, diagnostic and lab services and other health support services, pharmacies, law offices with blended approach, utility companies, media services, and customs brokerage firms are all permitted to operate. Essential government services which will be operating within this period will include critical government agencies, hospitals, fire stations, police and immigration, air and seaports, infrastructure department, the NEMO offices, public utility companies, and this recommendation shall be in effect as of February 22nd, 2021 for a 10-day period. We want to also say that all of the various recommendations that we have outlined, or at this point they are decisions, would actually take effect from 6 p.m. on Friday. So I just want to make that clear. The fourth recommendation that we came up with as a group, a decision rather, is the prohibition of all social gatherings. So no social gatherings at this point. In public and private settings, individuals are to limit their contact to their immediate households. No allowance is given for mass gatherings, social events of any kind, or loud music permits. The recommendation shall be in effect as of 6 p.m. Friday, the 22nd of January 2021 for a 10-day period. Now, it is important to note that we are not trying to infringe upon your rights, but what we are basically trying to do is to get a handle of a public health situation. So we're asking everyone just to do a little more so that you can protect yourself and those that you love. And so, recommendation number 5, decision number 5 rather, the prohibition of all social gatherings, but there is a very special exemption that was made for worship and religious activity to take place. We had a lot of consultation with the NEMAC group, the Cabinet of Ministers, and also the religious community, which included many pastors and members of the clergy. And so all daily regular church and religious services may operate using a blended approach of physical and online services, where such physical services such as, read that again. Where there is such physical service, such an assembly is limited to 25 people, inclusive of religious officials. Separate provisions apply for special religious rites, including christenings, weddings, and funerals. Those services may operate using a blended approach of physical and online, but where there is a physical service, such an assembly is limited to 10 individuals. And so we want to make it clear that because of the heightened need for prayer at this time of our country, because of the specialty and the uniqueness of the religious sector and the good job that they have been doing in enforcing the protocols by and large inside of their premises, we are permitting church services to take place, albeit under a reduced numbers. And so we submit this for the decision to take effect 6 p.m. Friday the 22nd of January 2021 for a 10-day period, by which we hope that the Ministry of Health would have had the situation under control. Restriction on the sale of alcohol was another decision that we took, and this one was announced earlier on. Information came to us that there was a lot of rush to various locations where individuals could have gotten that last drop of, they say in Saint Lucian parlance, throat sanitizer. And so I hope that you've all stocked up, because the sale of alcohol has been suspended at supermarkets, mini-marts, gas stations, restaurants, and bars. Liquor licenses have been suspended effective immediately Wednesday the 20th of January 2021. So it means as of today, we don't anticipate there to be a sale of any alcohol beverages at the various locations where we have indicated. Additionally, public consumption of that's alcohol. That confused me a little bit. Public consumption of alcohol is also prohibited, particularly as a feature in small social gatherings, at public beaches, at rivers, etc. This recommendation shall be in effect as of today, the 20th of January 2021, for a 21-day period. And so you might be wondering, what is the justification for this? But what we have recognized is that there has been a lot of social activity despite the protocols, despite the plea. We have heard that even people in quarantine, they have had parties, returning nationals. There was one famous party over Christmas at a house in Cap Estate. We were told there were over 100 individuals who were in attendance of that party. And so what we want to do is to remove the incentive. We all go to these parties, and alcohol consumption is at the center of these social gatherings. And what we really want to do is, we are pleading and we are asking you to help us stay at home. Only leave when necessary. We do not want to go to more drastic steps where it will be uncomfortable for our lives. And so let us help the Ministry of Health. Let us help those that we love by making sure that we conform to the protocols that exist. Restrictions on in dining at the restaurant. Restaurants and food vendors are to restrict services to takeaway only, as in dining services are strictly prohibited. Alcohol licensed restaurants and vendors must abide to the updated policy for liquor license suspension. This recommendation shall be in effect as of Friday, the 22nd of January from 6 p.m. for 10 days. Decision number 8, taken by the NEMAC team, the prohibition of all sporting activities, inclusive of gyms. This really was in the previous dispensation. We are at this point suspending all non-contact and contact sporting activities, inclusive of indoor and outdoor trainings, local competitions, gym workouts, or social activities are prohibited. Special provisions apply, however, for individuals or immediate family households to exercise in a safe open-air space. These activities may include running or walking, cycling, home gyms, yoga, etc. Special permission granted for training athletes requiring one-on-one coaching training for non-contact sports. Special permission granted for one-on-one personal training. This recommendation shall be in effect from Friday, 22nd of January for a period of 10 days. The last and 9th recommendation from the NEMAC grouping is as follows. All schools, public and private, are to remain physically closed and exclusively operational via multimedia platforms. Special allowances in the public education system are made to facilitate the following. 1, students of medical schools, grade 6, students who are sitting the CAPE examinations, secondary schools in Form 4 and 5s that are sitting CSEC other exams and preparing for practical evaluations. This recommendation shall be in effect as of Friday the 22nd of January for a 10-day period. And so these really are the 9 main recommendations decided upon by the NEMAC team, and they form the next set of protocols for a period ranging from 10 to 21 days in some instances. These will be gazetted, they will be published in local newspapers, they'll be online, and so please look out for the full document. If you are unsure about a particular area, you're able to access the information online. You can also call 311, where we have the staff that are there waiting and standing by so that you can gain clarity on the next set of protocols for the 10 to 21 day period. Thank you, Nicole.
Thank you very much, Minister. In light of some of the protocols you announced, I want to call on Dr. Fiona Meyer just to speak to the closure of schools.
Thank you, and good afternoon, everyone. Good afternoon to the head table, Honorable Prime Minister, Honorable Dominic Fede, Chief Medical Officer, Dr. Sharon Belma George, Deputy Commissioner, Mr. Daisy, and everybody here. Good afternoon. As a Department of Education, we do recognize that there must be a national effort. And so it speaks to all of us working together to ensure that this pandemic is taken under control. We embrace the fact that educational institutions can be part and can support this initiative, as it is for the well-being of everybody in St. Lucia. And so we continue, likewise, to speak to what can we do to make the situation better. We want to be part of the solution and not part of the problem or the issue. As responsible stakeholders in education, we embrace this in a significant manner. For us, the message remains the same: personal and collective responsibility of educators and everybody within our system. So, adults in the room in particular, our parents, our teachers, our administrators, our support staff, must take that responsibility quite seriously. We support the Department of Education, we support the national initiative to bring this under control, and we encourage everyone to model the correct behaviors, the protocols that are going to help us get through this, while at the same time educating our young ones, because they too can do the same. As a department, we remain vigilant as well as responsible in our interactions with everybody, as we want to wish the nation well and pledge our continued support to ensure that we bring this situation under control. I thank you.
Thank you very much, Dr. Meyer. We have quite a few questions from the media. So we will start with the media houses who are in studio with us before we take the questions from the Zoom link. I will ask just that you come up to the microphone, just identify yourself, and ask your question.
Nelsia Shalman, Choice TV. I think one of the most pressing questions is why 10 days and not 14, a full incubation cycle. Do we really think that 10 days will have a significant impact?
Yes, and we will be monitoring during the period of the 10 days. We'll be monitoring closely the numbers and also the tracing. So an assessment will be done next week in light of the cases that we're seeing and the contacts that we're monitoring to decide how we move after January 31st.
And in terms of spread, I think what a lot of people are gathering is that the local population is being blamed for the spread and the spike of COVID-19. Who exactly is in the forefront, or who's at the top of our list for spreading COVID? Have we abandoned the backdoor theory?
Like I indicated in my preamble, we have a number of risks for introduction and for spread at this time. And all of the risks contribute to the cases that we are seeing now. I don't know if you want me to go through them again or no.
It's okay.
It's okay, you have them. So we have the risks of persons coming in, both foreigners because of the destination, the numbers within the destination countries, and also our nationals coming in. So this is one of the risks for introduction and also for spread. For those coming in, we also have the risk of our nationals not adhering to home quarantine, and I indicated the level of risk. We had almost 1,500 nationals coming in, and the number of breaches that we got, persons coming in from high risk. We also had the issue of the COVID accommodation site that I spoke of, where we were able to see up to 60 cases coming from there. So we have the risks both of our nationals and foreigners coming in. It is a risk. We also have the risk of spread from the number of mass crowd activities that we saw over the season. And I really want to appeal to St. Lucians. Let us be honest, let us be real. We are dealing with a public health issue. This is a disease which the transmission has been well documented. And it is something from the model that we have put forward, we can live safely with it. We need not identify only some risk. We have to identify all of them if we have to be effective in controlling COVID-19. And we continue to see, even with the protocols that were in place for December, we all saw the big activities happening. We saw the crowding in the stores as well. And we also picked up through our environmental health inspectors on the tourism side, the breaches of the tourists to the protocols that were in place. And for us from public health, we do not accept any breaches. The same way we monitor and regulate breaches through our nationals, we monitor the breaches through the non-nationals in the sector. Every breach is a risk for community spread. So like I indicated in the numbers that we saw between November, December, and January, I indicated which one was from the breach, and even the change we saw between the 20-something of December into January, where a lot of the cases were linked to persons who were in social activities. From about the 12th of January onward, we're seeing persons who did not attend those activities. And those persons had maybe a child who was not a child, like an adult, because we noticed 25 to 49 is the age group that's most affected. When we link it, those persons in those activities now bring it to their family, bring it to their other close friends, bring it to their colleagues at work. So we're seeing the secondary and tertiary transmission from a lot of those activities that we saw between the end of December and January. And this is the data we use to guide as to where the risks are. And previously, we used that information to guide us as to which services we need to cut because of the high risk. At this point, the rate of increase is too high. We need to stop, break the chain of transmission. If not, the trajectory that we're seeing, we're not happy with the rate of transmission that we're seeing if we are to continue at this juncture. And this is why the measures that are put in place at this point are more general.
Just one more question from me for now. Given the dire nature of this situation, we saw our highest daily increase yesterday at 57. Why are we waiting until Friday to put these protocols into effect?
Well, I think that has to do with the legal issues. There are certain legal issues that have to be put in place, and a timeline is needed to put them in place. Legally, we aren't able to do it until that process occurs. So hence the delay till Friday.
And I guess we do want to reassure St. Lucians that based on the protocols, Supermarkets are remaining open. You will be able to get supplies as you need them, so there should be no mad rush to get that done. The protocols, as the minister said, will be published, so everyone will be able to see. Before we take another question in studio, we have a question from Zane Romulus of DBS via the Zoom chat. Are tourism-related properties included in the prohibition of the sale and consumption of alcohol? If not, why not? Minister, I know you're wearing the hat of Chairman of the Command Center today, but also as Minister of Tourism, if you could address this question.
Well, what a difficult task countries all over the world are facing to strike the balance between keeping their economy afloat. In this case, the cash cow or the backbone of our economy is the tourism industry. We have got some 6,000 people back at work. I'm happy. We lost some 15,000 jobs. And, this is happening at a time when we were gaining that momentum. But also, importantly, is that should something happen, we need to be connected to the rest of the world. We know, for example, that a number of our people, our population, they depend on medical services overseas. Just think about it. If there were no flights, if we had to close all the hotels, then there would be no reason for the planes to come. We as a population, it just doesn't make it commercially viable for us to keep the flights rolling. And so therefore, I think for two reasons, we have to keep the tourism sector going. One, to ensure that connectivity by keeping the planes flying for our population. And two, as well, there are just thousands of our citizens that rely on the jobs that the tourism industry generate. And so those are the two main reasons that we have to give it. Now, with whatever limited ability for people to travel or the demand that we see, because you've got all these restrictions in Canada, the UK, are very, very tough. And today happens to be Inauguration Day in the States, and we are not sure what will happen in the US. And so as the demand continues to be soft, we have to make sure that whatever ounce of economic extraction we can, that we do so. No one will want to fly to a tourism destination where they can't have a glass of wine. That becomes impractical and impossible. Also, I think that when we look at the science, we have not seen much evidence to suggest that there is a transmission rate of the virus from hotel guests to employees at hotels. So I think that those three discussions were the main. Also, but it's not just the tourists or the hotels that they're likely to sell to, but to keep the manufacturing sector is also allowed to export alcohol beverages. So we have a tremendous economic contribution that is being made by the alcohol sales. So we've got, for example, the brewery, I know they produce Heineken for the rest of the OECS and some CARICOM countries, which is a significant part of their business and the amount of jobs that they have as well. And then as well, think of the export business of Saint Lucia distillers and what that would mean if we shut the exports down as well. So we've had to make exemptions in tourism, in manufacturing. But we've always been transparent, Nicole, that we had to have a tourism bubble in order to keep our balance between economic recovery. COVID is and has brought about the greatest economic catastrophe since the Great Depression of the 1930s. Not the 2008 crisis, not 9/11, not the crashes that we have seen in the 1980s. Nothing has compared to this. Every economist in the world today is saying that the lockdown depression, is one that has annihilated economic progress that the world has not seen since the 1930s. And so it is a struggle for even bigger countries to be able to stay afloat, much less a country with such vulnerability such as ours. Small island developing states all over the world are finding it increasingly difficult to pay for the demand in the health cost, as well as to endure the massive job losses that they're facing and the great disruption to their economy. So our strategy has always been the tourism bubble has been one of the spinal cords or the backbone, if you will, to be able to strike that balance. But I want to assure the journalists that at every time, and that's why I want to commend the PM for his stewardship, being the Minister of Finance, and naturally your slant tends to be your line agency. He is the minister responsible for revenue. But at every time a decision comes up, which one do I sacrifice? Do I sacrifice the revenue performance of finance, or do I sacrifice the arrivals of tourists? He has always supported the CMO, and he has said, let's go and do that. And I think that the protocols which we're announcing today is an embodiment of that philosophy that we've had to ensure that the safety of the people of Saint Lucia is given paramount importance, and by protecting them, then I believe that the rest can follow. But we need a healthy population before anything else.
Thank you very much, Minister. Very concise answer. We now turn to the in-studio.
Good afternoon. Solange Alfred, HTS News Force. I have a follow-up to Zane Romulus's question. Given that the main risks were identified as high-risk international market and also non-adherence by guests to protocols, why then are we setting the precedent that there will not be, these same protocols will not be given to them?
Yeah, Prime Minister.
Thank you very much for the question. And I clearly understand the conflict in persons' minds with regards to these different sectors. So first of all, tourism is acting in a bubble and has its own separate protocols. And those protocols were put in place from very early to minimize the risk as much as possible. So there are protocols that exist in tourism that don't exist in any other sector. So staff that go to work leave their uniforms at work, leave their shoes at work. They have their own transportation system. Are under a lot of scrutiny in terms of their own health concerns. And even with regards to the behavior of the tourists are not allowed to go to their normal places. They can't go to the market, can't go to restaurants, can't go to church services, cannot interact with the local population. So the critical thing here was to have a product that was protecting us, but at the same time competitive out on a global basis. The breaches that the CMO indicated with the hotels had a lot to do with a very simple thing. Some of the hotels went to 100% occupancy during the Christmas and New Year's period. And we know with the protocols we've put in place that that's impossible to be able to do. And that's where some of the breaches occurred. Those have been addressed. The most offensive one, the hotel was restricted on bringing any new guest in. Secondly, that we have now in these protocols stopped any tours so that cause persons to go into the community. So the tour to go to the Sulphur Springs will be suspended during this particular period of time. And so protocols are applied to each of the different sectors based on the level of risk. We're also seeing a significant drop-off in a number of persons coming in. Canada has imposed now PCR testing on return and compulsory two-week quarantining. Plus now they're charging $260 per person for the PCR test. The UK now has announced PCR test on the way back. And there's a lot of issues that have been raised with regards to what happens if someone tests positive here, who's going to flip the bill. So the hotels now are adding an insurance to cover those costs for those individuals and not to overburden the state. But there is a risk that's associated to it. So we're naturally seeing the numbers in the hotel sector going down. The protocols that are being imposed, let us understand what we're attempting to do here. It is the level of social activity and people interacting with each other that is causing the problem. And while it's okay to go to your business place, people aren't hugging and kissing each other, and they ought not to be doing that. But activities that cause those things to happen. This is where we're seeing a significant risk. And in the meetings that we've had with the team, that this is the level of activity that we want to curtail. You know, tourists mingling with themselves is much less risk than our local population mingling with themselves. And I want everybody to really appreciate what we have done. We've created the bubble. And they are under a very different protocol regime than any other sector in Saint Lucia. But it's necessary, as the minister said, one, because if we don't have some level of tourism activity, it is going to significantly impact the airlift coming into Saint Lucia. So imagine if we didn't have any of the hotels open, more than likely what our air access would look like is we would all be flying to Barbados in order to be able to get out. And so I think that Saint Lucia is too active a place, and we depend too much on international access to have allowed that to happen. And so this is where we were able to find, we think, a balance in protecting Saint Lucians, but at the same time keeping the activity going, keeping our ports open. So for instance, there are some activities we would not allow. There are some hotels, I won't name them, but that have not opened because they don't have enough services to have created the kind of environment that we believe that people would stay on property. And so therefore they have not opened, and that's why the certification process. The process of getting individual villas approved didn't happen overnight. And those villas had to agree actually in hiring their own security to ensure that the guests were following the levels of protocols.
Mixed-use properties.
You have to really look at this from an entire perspective and not to just look at it from a traditional perspective. We're not speaking with apples to apples at this point. And this is why in my introduction, I was really trying to give all of you, the public of Saint Lucia, a sense of the difficulty in finding this balance. But it's a balance that we must be able to find. And I really want to thank the CMO's team because they're tough. Very, very tough in terms of, you know, where those risks are. Right now, the objective of what we're doing, and the question was asked, why 10 days? 10 days is the minimum we believe that we can implement. And what is it we're trying to do? People need to stop and reflect. Go to work, go home. It's what we've been saying. Sadly, the messaging has not been working. We would have hoped that when persons saw the numbers increasing, that they would have. I mean, education. Why are we should be outraged as a public that the behavior that we've had was so irresponsible during the Christmas and New Year's that it's affected kids going back to school. How is it that they don't matter? Why are we not getting mad at ourselves? And that's why I say let's treat this as a report card. And we have a failing grade at this point. We have no one else to blame but ourselves. Taiwan and some other countries around the world have shown you can have school, you can go to business, you can do all the things that you want to do. Follow the protocols. Follow the protocols. That's all we have to do. We control our own destiny, and we can have it all. We can go to school, we can be partying, we can do all the things we want to do. Follow the protocols. But in the absence of that, this is to try to be a reminder and to regain some of the space that we have lost. And I'm appealing even to the media. That is the message. We have to do better. We can do better. We must do better. We don't have a reserve. You know, Taiwan is sitting on the third largest reserve of cash. Trinidad can close down its borders. It has $8 billion in reserves from its oil fund. But even in closing down, they have cases. Canada, with closing down, they have cases. In fact, their economy is contracted by 11%. None of us are immune from some of the things that we're talking about. But if we're going to get into the myopic detail of trying to find out whether, in fact, that this makes sense, that makes sense, it makes sense when you look at it from the perspective of how COVID spreads. That is the microscope you must look through.
My second question is twofold. Are COVID-19 positive patients being allowed to recover at home? And given this third wave, has the situation at our hospitals reached breaking point?
Yes, with the increasing number of cases, we have taken a policy to allow isolation at home for persons who meet the criteria and are asymptomatic or very mild. Because if you note, for example, in my update, I said we had how many active cases? So
359.
Yes, 287 active cases we have now. So the capacity to be able to keep, and these are mild and asymptomatic persons, most of them, we only have one person in critical care. Notwithstanding, persons who have moderate or don't have the conditions at home for isolation, we keep those within the hospital setting. So the patients that we have at the respiratory hospital, the majority of them do not actually need hospital care. They're there for isolation because they don't have safe isolation conditions at home. We're also using some guest houses and inns to house some of those positive patients. In terms of our capacity, we are not at a breaking point. We only have one critical person in care at this point. Our recoveries so far have been 418.
Thank you very much, CMO. We have a question coming from the Zoom platform from Tresha Lionel, who has indicated that qualified sources within the health sector have advised that our population of 170,000, we would need, CMO, at least 100 functional ventilators. But the question is, she's aware that we've had ventilators donated to us. Do we have enough in the event of an outbreak, and when will they be operationalized?
Yes, we've increased the ventilator capacity to manage COVID-19. We have 24 new ventilators, and also the other oxygen machines that's being used as well. For COVID-19 generally, in terms of the percentage, it's 5% of cases that usually needs critical care within your hospital. So for the number of cases that we've had, the number of active cases that are 287, let us say 5% of that, that's
15.
5, 10, 15. That would be 15 people based on the number of active cases who, at this point, based on the statistics, which is less than the number of ventilators. The clinical team, they're monitoring the situation in terms of setup. We always ensure that we have extra ventilators prepared just in case. And this is one of the things. We are hoping later this week to have a press conference indicating the measures that have been put in place by the health sector to manage the increased cases. And in this press conference, we'll give you details from every aspect of management, and one of them is the respiratory hospital.
Okay, we'll take a question. We have to wrap up, but we'll take 2 more questions. Nelsia?
Prime Minister, I think you'll be best poised to answer this question.
You know this?
No.
Okay.
Go ahead.
Yeah?
Yes.
We have cited several times that we cannot close our borders, and it's almost economically impossible to close our borders. Moving forward, what lessons can you cite in terms of a need for diversification of our economy to still, keep our foot in the door of tourism, but to add on things that would be kind of our safety nets for the next pandemic, because we know that there will be another pandemic?
I'm so glad that you've asked that question, because certainly the evidence that we've seen on a global basis, this affected everyone. It didn't matter whether you were tourism-centric or not. When you're hearing that the German economy is contracted by more than 5%, the UK economy by 10%, Canadian economy by 11%, these are certainly not countries that you think of on the top of your head that are tourism-dependent. And I welcome the continual discussion about the economic strategy to grow our economy. Tourism, it's not tourism or something else. It is tourism and all of those other things. And the growth of tourism continues to support the growth of our agricultural sector. It supports the growth of our manufacturing sector. It supports the growth of our orange economy. It supports the growth of our financial services. Because again, as we've said, we're too small of a local population to have the air access that we're currently having. It's tourism that's driving that. We did a very interesting diagnostic study on the breakdown of government's revenue. And tourism by far, contrary to what people believe, without corporate tax, is the highest contributor to the government's revenues. So the question becomes, if you didn't have tourism, which is what I would not want to ask, well, how would you substitute that? So agriculture and manufacturing and financial services all are limited in their own ways. And so the return that we're getting on our tourism investment is significant. The opportunity to grow in the market, and as I said, we're leaving this much more encouraged. Here we are in the midst of this pandemic, we still have people who want to come to Saint Lucia. We're seeing that even post the vaccine, that we believe that leisure travel, particularly to the Caribbean, is going to grow even faster. So the diversification of the economy, which we're committed to, is to use the leverage from tourism in the interim to allow the other sectors to grow significantly. And I've always used this example is of the rum cake, Tortuga rum cake, that started by selling to hotels in Cayman and then became a duty-free product in the Caribbean and now has become global. So regardless of what happens to the tourism market in Cayman, the company is going to continue to grow. We want to see that. We want to invest. I've met some young kids that it just encourages me and fires me up to see what they're doing. We've had a kid that's using Penny Pinch to develop a program to help in persons purchasing products. And he's not looking just at Saint Lucia, he's looking at the OECS. I met some other kids who've got a product to be able to sanitize public spaces. We know, post-COVID, sanitization of public spaces will continue. We're now recognizing that we were underachieving in that area globally. So going on a plane to clean a plane between flights, what was it? People going around and picking up the paper, fluffing up the pillow, right? And when you think of the number of people that are going on and that physical activity, that was clearly not to the highest level. So I'm just really excited to see that we do have resilience in tourism, that our differentiation of our product has stood up, and more importantly, that I believe that younger persons and persons who have lost their job are turning around and getting into their own private sector activities, and I think that we're going to see a much stronger economy in the future than we have in the past.
Okay, on an unrelated note, we spoke a lot about the tourism bubble. We have St. Lucians working in the tourism industry, and although the hotels themselves are their own little bubble, I know for a fact that workers are going in and out of those hotels on a daily basis. How do we ensure that either they're not getting it in the hotel or getting it outside and bringing it to either location? How do we ensure that there's no cross-transmission between the hotels and our St. Lucian community? And how do you instill that confidence in the St. Lucian public that tourism isn't as big of a threat as they think it is?
I can answer the question, but I think I'm going to pass over to the CMO because I think it's going to be better coming from her, because that was a significant discussion that we had in the beginning, and certainly over the last 6-8 months, those protocols are being strengthened. So, Madam CMO.
Yeah, the exhaustive number of protocols that have been put in place for the tourism sector, because if you could remember, when we planned the opening of the economy, for level 5, the tourism sector was really at the end because it was seen as one of the higher risks for opening. And to facilitate this, then there were countless protocols that are now in place at every single service within the tourism sector. And those
You can just hint it because I got a question I told them.
Enough is enough. People need to accept. Enough is enough.
We apologize for the break in continuity of the program. In live programming, these things do happen. We want to get right back into our discussion. We have a final question from DBS in relation to the vaccine rollout. Obviously, there will be more information coming out on NTN and other partner stations on the vaccine rollout, but right away, CMO, I just want to direct the question to you. When are we procuring the vaccines for our population, and when will the public education campaign begin to inform citizens about the COVID-19 vaccine?
Yes, we are working with WHO. We've signed on to the COVAX facility for the advanced marketing countries. Their timeline is that we'll have it available by the end of March. And we are really hoping that, although there were delays with WHO approving the vaccine that we were working with, we are hoping that we don't get delays in terms of the distribution into countries. And at the end of March, we'll receive enough vaccine to cover 2 doses for 20% of our population. And we have worked out the strategy to allow us to be able to ensure that those that are of higher risk, that is our frontliners, and also persons with chronic and underlying health conditions, would be the first to receive that vaccine, and it is in 2 doses. And also to note, the vaccine is for persons 16 years and older. So we will be putting out a release tomorrow to give an update to the population on more information, and our stakeholder consultations will be starting next week as well, starting with the health-related sectors.
Okay, thank you very much, CMO. We also have in studio, as I mentioned earlier, the Deputy Police Commissioner. So I just want him to come up and say a few words based on some of the discussions we have been having today, because enforcement is such a huge part of that. I now invite Mr. Daisy to come up.
Yes, Honorable Prime Minister and Minister Fede, our CMO, Chief Education Officer, good afternoon. Actually, these new measures that we are getting today is, I would say, as a direct result of persons not complying to protocols. We have come there on several or numerous occasions asking persons for their ability to comply, being responsible, but it appears that persons, they do not follow protocols, they do not want to follow protocols. However, I must say that there are individuals who were following protocols, who continue to follow protocols, and I'm thanking them for that. So we are asking in these new measures that you follow the protocols, because where protocols are not followed, we see where it leads us to, that stricter measures would be put in place, as like today. So we are urging persons to please comply, be responsible, encourage others to adhere to the protocols, because law enforcement will be there, and where protocols are not followed, I think it is reasonable enough to think or to understand that we need to be serious and take action. We have had the COVID wardens, we have had officers going out there to persons, warning them and so on, but I think the time has come that we have to take definite action against persons who do not comply with the protocol. I'm urging members of the public, if you do follow the protocols, and I am sure CMO would see a reduce in the numbers, and that we could go back to normalcy or bring back some of the activities that we are cutting down. We realize that with social activities, that is one area that we had to look at. And I must say, law enforcement, we were actually putting pressure to have it curtailed, because we realize that persons do not, especially at the bars, persons come, they do not wear their mask, they do not use the sanitizers, they do not use the physical distancing that is necessary, and as a result, we see what happens. I must say, having said this, it's not that this was the only reason, because CMO have indicated other reasons that may have contributed, but we saw that this was one of the areas, especially persons having a party with 100 persons, being in a pool, so many persons. So it made it easy for transmission. So we are asking persons to please take heed of the new measures in place so that we have no issues with the police. I thank you.
Thank you very much, Deputy Police Commissioner. CMO, before we had our break, you were responding to a question with regard to how do we mitigate against the spread of COVID from locals working in the hotels to tourists. I just wanted you to wrap up that answer. So just in terms of continuity, people have the answer. So if you could just finish up your answer on that one.
Okay, thank you very much. I was just indicating that the range of protocols at every sector and service within the hotels is really the preventative measure, so that, and they are put in place so that even though there is a positive, let us say there's a positive guess, if they are followed, there should not be transmission to the workers or to other guests. And we have managed positive guests at a range of hotels, and by testing the workers and testing the guests, once the protocol is adhered to, we do not see transmission. The case that we did have to manage, it was because of breaches of protocols on a number of levels. So we ensure for the persons coming into the accommodation sector and also for those going back home to their family, that those measures were put in place to protect them from community spread.
Thank you very much, CMO. Thank you very much to the media who have joined us today for this update and press conference. Thank you to St. Lucians who have been watching at home. As we wrap up, I do want to just indicate that the measures and the protocols announced today will be available online. And I do want to give the final word in 5 lines or less to the Prime Minister just to take us home.
Thank you very much, Nicole. And, again, I want to thank all of the frontliners. I want to thank the vast majority of the population that have understood the need for the protocols and have been adhering to them. I also want to follow in the footsteps of Ralph Gonzalez, Prime Minister Gonzalez, who has closed the country for 4 days. And what he did, he said, it's time for reflection. And I think that that's what we need to do. We need to reflect. And we need to come out of this period with corrective behavior and understand that we are no longer just responsible for ourselves, but we're responsible for our family, our neighbors, and our country. And we all share in that responsibility. The government and none of the institutions in St. Lucia can do this by ourselves. So it's going to take a collective effort to fight this enemy, and this enemy called COVID that is doing everything it can to disrupt this country. And we can show, and we have shown in the past, that we're much more resilient than that. So I just want to say that we need to reflect. I want to say also that I'm very proud of what we've achieved. And we should all be, as a nation, proud of what we have achieved. Because from the get-go, we have managed this situation, and today, that we can have as many cases as we've had, and we've not put the country at a significant risk. That we've maintained the ICU labs. We still have the Cuban doctors and nurses here, so from a physical perspective, we can handle the outbreak that we've had. But the CMO and the command center have issued an alarm bell to us. We're heading in the wrong direction. And while we still have time to correct it, let's do so. Let's do this together. Let's make this happen. We can do it. We're better than that. And we all need to hold each other accountable for our own behavior. It's within our own capacity. We have no one else to blame for this. Everybody else is fighting their own battle on the outside. And I'm just very grateful to the team and the work that we've been doing with CARFA in particular, because they sit here many times as an unsung hero to make sure that we get the vaccine, very, very importantly. There were just 5 long sentences. Thank you very much.
Thank you very much once again, Prime Minister Honorable Alan Shastney. Thank you to our Minister for Tourism and Chairman of the Command Center. Thank you to our Chief Medical Officer, our Deputy Police Commissioner, and our Chief Education Officer. And thank you for staying with us in this special update to the nation on the National Television Network. Thank you.